Assalamu alaikum. Good morning to everyone. I am Dr. Nusrat Jahan, Senior Lecturer, Department of Physiology, Bashundhara Ad-din Medical College. Today I will discuss about pituitary gland, and these are the topics of my lecture. Let's start. Pituitary gland is also called hypophysis. It is located in the Scilla turcica, a bony cavity at the base of the skull. It is about 1 centimeter in diameter and 0.5 to 1 gram in weight. And physiologically it is divided into two portions, that is the anterior pituitary gland, that is also called adenohypophysis, and the posterior pituitary gland, that is also called neurohypophysis. Now I tell about the hormones that are secreted from the anterior pituitary glands. Hormones those are secreted from the anterior pituitary glands are growth hormone, adrenocorticotropic hormone, thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, and last one is the prolactin. And hormone those secreted from the posterior pituitary glands are antidiuretic hormone or vasopressin, and another one is oxytocin. Now I discuss about the cells that are cells of the anterior pituitary glands. There are 5 types of cells present in the anterior pituitary glands. These are somatotrophs. It accounts about 30 to 40% of the cell and secretes growth hormone. Adrenocorticotrophs, which accounts about 20% of the cell and secretes adrenocorticotropin hormone. Thyrotrophs that secretes thyroid stimulating hormone. Gonadotrophs that secrete luteinizing hormone and follicle stimulating hormone. And last one is the lactotrophs, which secrete prolactin. The hypothalamic control of the anterior pituitary gland and the posterior pituitary gland hormone secretion. Hypothalamus is control the anterior pituitary gland secretion by its stimulating and inhibitory hormone secretion, and it is through the hypothalamic hypophyseal portal vessels. And hypothalamic posterior pituitary hormones are synthesized in the hypothalamus, the supraoptic and paraventricular nucleus of the hypothalamus, and then transported into the posterior pituitary gland through the hypothalamic hypophyseal tract. Now I discuss about the function of growth hormone. Growth hormone is a general hormone and it has many effects throughout the body. First of all, the effect of growth hormone on growth. Growth hormone causes growth of almost all the tissue of the body which are capable of growing. It increases the cell size and also the number of the cells. And it also differentiates the different type of cells of the body, which are the bone cells and muscle cells. Now the effect of growth hormone on metabolism. Growth hormone has several effects on carbohydrate, protein and fat metabolism. On carbohydrate metabolism, it causes the increased blood glucose level by reducing the uptake of glucose from the tissue, especially the skeletal muscle and fat, and reduce the utilization of the glucose for energy and increase the production of glucose by the liver cell. An effect of growth hormone on protein metabolism. It increases the transport of amino acid through the cell membrane and increase the transcription of DNA to form mRNA, and increase the translation of mRNA to form new protein. And the effect of growth hormone on fat metabolism. It causes the mobilization of the free fatty acid from the adipose tissue into the body fluid. Thus increases the concentration of fatty acid in the body fluid and subsequent use for the energy. Next one, and growth hormone has several other effects such as the diabetogenic effects and the ketogenic effect. Diabetogenic effect. Growth hormone causes the increased blood glucose level, which causes the stimulation of beta cell of pancreas to secrete excess insulin, and growth hormone has a direct stimulatory effect on beta cell. Combination of these two stimulatory effects causes the overstimulation of beta cell of the pancreas. So the beta cell may be burned out and causes the diabetic mellitus. So it is called the diabetogenic effect of growth hormone. Another one is ketogenic effect. Excess growth hormone causes excess mobilization of free fatty acid from the adipose tissue into the body fluid, and excess production of acetyl-CoA acetoacetic acid from the liver, and this is secreted into the body fluid to cause ketosis. These all are the effect of growth hormone. Now I am discuss about the hypofunction of growth hormone. When the growth hormone is secreted, secretion is reduced, and in the childhood that causes dwarfism. Dwarfism is characterized by a short statures, and the proportionally growth of the soft tissue and skeleton is occurs, but the growth of this is very slower. And the hypersecretion of the growth hormone causes giantism and acromegaly. Giantism occurs when the hypersecretion of the growth hormone occurs before the puberty, when epiphysis does not fuse with the diaphysis. And in this case, the patient become long as much as 8 feet, and hyperglycemia may develop, and this causes to diabetic mellitus. And the acromegaly, which is characterized by it occurs when the hypersecretion of the growth hormone occurs after puberty or during adulthood, when the epiphysis already fuses with the diaphysis. And in this time, the acral parts of the body become enlarged, such as the hands, feet, and fingers. And there are some clinical features occurs in the acromegaly. These are protrusion of the lower jaw, standing of the forehead, enlargement of the hand, feet, and fingers, nose bones, and some changes occurs in the vertebra, that is the kyphosis and hunched back, and enlargement occurs also in the soft tissue such as tongue, liver, and kidney. This all about my lecture. Thank you all.